Now we're trying to move to the next issue which we'll be discussing, and this is what is known as shoulder instability. In fact, we're trying to move around all the common joints that usually could have an instability and talk about them, So shoulder instability is just another name for what? Shoulder dislocation, so to say, Alright. Well, dislocation now could be of different types. It could be partial, where this glenal foci was shallow, or it could be complete. So it's just inability of the shoulder joint, that's glenohumeral joint, to maintain its normal position. So it will now lead to all those abnormal movements, subluxation, and even complete dislocation. So types of shoulder instability, we have the traumatic instability. Of course, that one is caused by physical injury. We have atraumatic instability. This one maybe is just an underlying disease condition, so it's making your joints very, very soft. Okay, it's making your joints very soft. Then we have the multidirectional instability. So this one is instability in more than one direction. You could have the anterior instability, posterior instability, and even instability downwards. Okay, so this is anterior instability or anterior dislocation, then also posterior dislocation. So causes and risk factors is all those traumas, falls, collision, sports injury, repetitive stress, congenital laxity. So you have some issues that basically they are making your ligaments to be very, very so elastic. Maybe there was a previous dislocation. So clinical features is what? Pain when you try to move. You feel as if your shoulder is going out. Recurring dislocation because the head of the femur keeps going out. The head of the humerus keeps going out, right? Weakness and also reduced range of motion. Okay, so apprehension test will be positive. So you do all those imagings, that's clinical examination. All right, apprehension test, relocation test, and the sulcus sign. So you also image X-rays, MRIs, and CT scans just to confirm that issue. So management, the person should rest. They shouldn't be using that part of the body like they used to. Also physiotherapy and also bracings. So surgically, you can do all those arthroscopic Bankart repair, capsular shift and plication, lateral jet procedures. Okay, and all of that. Okay, so this is what we got for shoulder instability, or you could say shoulder dislocation.